egg freezing, the process in you. Before you start, if you haven't already, you'll have a consultation with a doctor and have a blood test called AMH to determine how many eggs you are likely to get from one cycle. Before moving to your cycle, you'll watch this video and then review any questions and sign consents with a member of our nursing team. You will then have one or more egg freezing cycles. Go on with your life until someday you might use your frozen eggs. The process of one egg retrieval cycle can be summarized by 4 steps. First, you will take medications to stimulate your ovaries to produce more than one follicle, which contains the egg. After 9 to 12 days of stimulation, you will take a medication to trigger final egg maturation, and 36 hours later, will have an egg retrieval at the clinic. Your eggs will be frozen within a few hours of collection. The process ends with their storage in liquid nitrogen, keeping them safe until you decide when to use them. In order to understand the possible outcomes when and if you decide to use your frozen eggs, you need a good idea of how many you are likely to get today and how your age determines how many eggs you need for the future. You will also want to understand what goes into an IVF cycle in the future, something we won't cover in this video. While the process of egg freezing is simple, understanding how many eggs you might get and how many you need for a good chance of getting a baby is complicated. The number of eggs you decide to freeze is based on how many we can expect from you today based on your blood test, AMH, and your age, which predicts how many eggs you need in the future to have a good chance of having a baby. We use your AMH level to estimate how many eggs you obtain from one cycle. AMH is anti-Müllerian hormone and is a measure of how many small follicles are growing in your ovary. Each follicle contains an egg. AMH is not a direct measure of your fertility, only an estimate of how you will respond to ovarian stimulation. The number of eggs you can expect from one cycle is not influenced by your age, so everyone can use this table to get an idea of how many eggs they might get from one cycle. Note that this is only an average, and your results may be quite different. Now that you have an estimate of how many eggs you can expect from one cycle, it's important to ask how many eggs you'll need for a 50% chance of having a baby. There are several large studies, and they all provide similar estimates. For women 25 to 37, this number is 8 to 10 eggs, while the numbers increase with age. To summarize, we use your age to determine how many eggs you need for a 50% chance of having a baby, and your AMH to estimate how many eggs we hope to get in one cycle. While the decline in egg quality and fertility varies for individuals, we consider 38 to be the age where this decline starts to quicken. For women less than 38, egg quality is relatively similar regardless of age. Using a goal of a 50% chance of having a baby, women less than 38 need 10 mature eggs frozen. If your AMH is less than 5 picomoles, this means you should expect to need at least 2 to 3 stimulation and egg freezing cycles. If your AMH is 5 to 15, then you should expect 1 to 2 cycles. And if your AMH is greater than 15, then you will likely need only 1 cycle. even if you are in the AMH greater than 15 group, you may need more than one cycle, since some women in this group end up with fewer than 8 mature eggs. Using a goal of a 50% chance of having a baby, women 38 to 40 need about 15 mature eggs frozen. If your AMH is less than 5 picomoles, this means you should expect to need at least 3 stimulation and egg freezing cycles. If your AMH is 5 to 15, then you should expect 2 cycles. And if your AMH is greater than 15, then you will likely need 1 to 2 cycles. For women 41 to 42, the number of mature eggs needed to have a 50% chance of having a baby is about 25. If your AMH is less than 5 picomoles, this means you may need as many as 5 stimulation and egg freezing cycles. If your AMH is 5 to 15, then you should expect at least 3 cycles. And if your AMH is greater than 15, then you may only need 2 cycles. For many women, freezing 10 eggs is a good result. In a review of our own patient data, we found that 8 out of 10 women with an AMH of less than 5 picomoles do not obtain 10 usable eggs. For an AMH of 5 to 15, 7 of 10 women do not obtain 10 usable eggs from one cycle. And even though the average number of eggs is 14, 5 out of 10 women with an AMH of 15 to 30 do not obtain 10 usable eggs from one cycle. And finally, for women with very high AMH of greater than 30 picomoles, 20% have a chance of having fewer than 10 eggs from one cycle. As always, there are important things to keep in mind. First, there is no guarantee. Just like IVF for infertile patients, egg freezing does not have a 100% success rate. Egg freezing is all about numbers. The more eggs frozen, the more embryos and the better chance of a baby. Fewer eggs means both lower chance of having a baby and a possibility that there will not be an embryo to transfer. And about 1 out of 10 women have eggs that do not do well with freezing. We have no way of predicting this. What are the results you can expect after your egg retrieval? In most cases, you should get the number of eggs estimated. While rare, it is possible that you do not have any eggs that are usable, and it is not uncommon to get fewer eggs than you expect. It is also possible to get a lot of eggs where most of them are not usable. If you have 10 follicles, we normally expect to get 7 or 8 eggs. Of these eggs, most are usually usable, but sometimes a lot of them are immature and thus unusable. Sometimes women can make greater than 20 follicles and the eggs obtained are mostly unusable. For women who make a lot of eggs, there is a risk of a complication from the ovarian stimulation called OHSS. You should ask your doctor about this risk. What results can you get when you use your eggs? The most likely scenarios are either to obtain one embryo from your group of eggs, or to obtain several embryos, where you have one to transfer and one or more embryos to freeze. However, depending on the number you have and how well they tolerate freezing, it is possible that none survive the thaw, or none fertilize, or none make embryos that can be transferred. This occurs for about 1 in 10 women. For each cycle where you have an embryo transfer, the chance of having a baby depends on your age. The youngest patients have a 50% chance of having a baby from one embryo transfer, whereas women over 37 will likely need more than one transfer to have a baby. The number of eggs you need and the chances for success can be confusing. Please ask our team if you have any further questions.